Hello everyone, my name is Muhammad Haris and you are watching the Medical Science YouTube channel. As we have started earlier on the upper limb anatomy, so today we are going to very important one of the important one of the upper limb anatomy that is named as clavicle. So starting up our topic without any wastage of the time, first of all, we will look at that what is actually clavicle. Clavicle is actually the long bone. It supports the shoulder so that the arm can swing clearly away from the trunk of the body. So definitely it allows the movement in the shoulder joint and helps a lot in the movement of the shoulder. So the main function of clavicle is also been this, that it transmits the weight of the limb to the sternum, and moreover the clavicle has as usual called shaft and the two ends named as lateral and the medial. So after the general overview, let's take a look at the side determination characters for the clavicle. As discussed earlier, that the clavicle has the two ends named as the lateral and the medial one. So in the side determination, you have to know that the lateral end of the clavicle is flat and the medial end is large and quadrilateral, mean it has the four sides like structure. So that is the quadrilateral. Moreover, the shaft of the clavicle is curved so that it is convex forward in its medial 2/3 and concave forward in its lateral 1/3. So that are the some characters for the side determination of the clavicle. Now moving on to the some unique features of the clavicles, let's talk about some of the peculiarities of the clavicle. So one of the most important unique feature of the clavicle is this, that it is the only long bone that lies up horizontally. So all the long bones are lying up the perpendicular, you can say, but this is the only long bone that is lying horizontally. So this is the one of the very unique feature of the clavicle with respect to the other bones. Secondly, it is the subcutaneous throughout. One can feel it. The man having the low fat can easily feel the clavicle by touching the area of the clavicle. Next, the very important and the interesting thing to talk about and the different feature of the clavicle is that it is the first bone. The clavicle is the first bone which start ossifying. So that's clear now that the ossification first of all starts up in the clavicle, and it has only long bone which has two primary centers for the ossification process. So the next thing is this, that how clavicle connects with the scapula. So this is important. We have studied in the previous video that the scapula contain one of the process named as the acromion process. So that is pretty important for the connection between the clavicle and scapula. Acromion is actually the peak of the shoulder. You can also feel it, and it is the site where the clavicle and scapula actually connected. So it is pretty important. So that's all from the today's video. In the next video we will look at the anatomy of the humerus bone. So till the next video, it's time to say goodbye from the medical science.